talk about what to expect when expecting, but the dental version. Today I want to talk to you about what expecting moms should know about dental care. Many healthcare providers, like dentists, are afraid of pregnant women, but neglecting pregnant women can lead to poor outcomes for both mom and baby. So today I want to talk to you about some facts about whether or not it's wise and safe to visit the dentist while pregnant, and what changes women can expect to their teeth and gums. And I'm coming to you today from a particularly personal place because I'm actually 6 months pregnant, so I hope to be able to provide some insight there. Let's get started. So when having a child, it's really essential to think about the health of both mom and baby, of course. However, there's one key aspect of pregnancy that's often overlooked, and that's oral health or dental health. Some studies show that poor maternal or oral health can have a significant impact on the woman's overall health and even of that of her child. So most expecting parents don't always realize the importance of oral health, but the good news is that there's very specific steps that you can take to help ensure great oral health for years to come. I'm going to break down today's video into 5 easy recommendations. First, I recommend trying to make a dental appointment before conception, which I know is probably a little bit too late for many of us watching this video. But the teeth and gums can be professionally assessed, and any oral health problems can be treated before pregnancy. If you've been putting off any major dental treatment, particularly any treatment of gum disease, it's a good idea to have that taken care of before the pregnancy starts. There's several systematic reviews that have concluded that there is an association between periodontitis or advanced gum disease and preterm birth and low birth weight. So it is an association, it's not a causation, but it's still a good idea to have any gum disease under control before becoming pregnant if possible. And along those lines, some dentists even recommend visiting them during each trimester to keep a close eye on the sensitive time if you do have a history of gum disease. So be sure to discuss your oral health history with your dentist. This is also a great time to ensure your daily oral health routine is in great shape so that you can maintain it throughout the pregnancy. Number 2, so the next thing is routine dental care is just as important during those 9 to 10 months of pregnancy, and it can be done at any time. But elective dental procedures should probably be delayed until after the baby is born. The ADA, or the American Dental Association, and the American Congress of Obstetricians and Gynecologists, they do consider x-rays to be safe for all pregnant patients, no matter the stage. However, it is recommended that you wear a lead apron so that the abdomen and thyroid are extra safe. Further, the ADA and ACOG agree that emergency dental treatments such as extractions, root canals, tooth restorations, they can all be performed very safely during pregnancy, and actually delaying the treatment could result in more complex problems, which we want to avoid. Plus, who wants to have like a root canal on the to-do list after the newborn baby is here? The easiest time for expecting moms to visit the dentist is usually before the 3rd trimester, because the baby in the 1st and 2nd trimester, it's not quite large enough to put a lot of pressure on the blood supply when mom lays all the way back. Okay, number 3, keeping up your regular home dental care is really important. Because pregnancy causes hormonal changes and can put you at an increased risk for gum disease and pregnancy gingivitis, which is a condition that causes your tender gums to bleed really, really easily, it's really important to keep up your regular dental care. It's very common for pregnant women to experience tender gums. I was very, very lucky that this hasn't affected me, but you need to keep this in mind because it's really important to get into a really good routine, brushing and especially flossing. If you do notice any out of ordinary changes during your pregnancy, such as extreme tenderness, bleeding, or gum swelling in your mouth, do get in touch with your dentist right away. Number 4, it's very common for expecting mothers to avoid brushing their teeth due to morning sickness. I completely felt this. I actually didn't have morning sickness. As we know, it's kind of all day sickness. And every time I would go to brush my teeth at night, I would feel extremely nauseous and almost couldn't do it. However, we know that poor oral hygiene can lead to other problems. I, of course, wanted to avoid tooth decay and gum disease. And so to help mitigate, a little bit less toothbrushing, it is recommended to use a fluoridated toothpaste. Also, chewing sugarless gum throughout the day and drinking plenty of water, all those things help to really minimize the risk of dental problems. If you do experience a lot of vomiting, do bring this up to your dentist because they may also recommend a fluoride varnish or a prescription fluoride toothpaste. This is actually what I switched to, and they go directly on your teeth to help prevent tooth decay during this time. Number 5, so lastly, my recommendation is to do your best to eat a healthy, balanced diet. Don't be like me and eat McDonald's every couple weeks. The baby's first teeth do begin to develop about 3 months into pregnancy, which is really early on. So healthy diets containing dairy products, cheese, yogurt, those are all a good source of essential minerals, and they're crucial for the baby's developing teeth, their gums, and their bones. So if you feel like you're not getting a well-balanced diet, especially if you're not taking a prenatal vitamin, do speak to your OBGYN about how you can best supplement your diet during this time. Very good. Those are my 5 recommendations. I want to move on to some frequently asked questions that I receive all the time from my pregnant patients. The first is, what trimester is the safest to visit the dentist? Well, every trimester, as we talked about, is perfectly safe to visit the dentist, but if I had to pick a time in terms of ease to visit the dentist, I would recommend visiting during the 2nd trimester if you can time that out appropriately. Moms, as we know, can be very nauseous and very exhausted during the 1st trimester. It can just make the dental visit seem much more icky. And then we know during the 3rd trimester, you can already be quite big. And so laying in the dental chair for any period of time, even for a dental cleaning, could be really uncomfortable. So the 2nd trimester tends to be the easiest. I do want to emphasize again that both the ADA, the American Dental Association, and the American Congress of Obstetricians and Gynecologists, they do agree that actual dental care, so cavities, crowns, routine dental care can be performed at any time, and it's actually recommended to continue with dental treatment so that no complex problems develop. Of course, this is a conversation that you should have with both your dentist and your OB to make sure that they're both on the same page, that there's no risk to your particular unborn child. But problems that are ignored during pregnancy can become bigger problems later on. Okay, my next frequently asked question, what dental conditions are more common during pregnancy? So the first is gingivitis. A lot of pregnant women will get gingivitis, those really tender gums, inflamed gums that bleed really easily. So we've talked about that a lot. I'm going to move on to a couple other things that I see. Dental cavities do occur much more frequently during pregnancy, even in women who don't really have a history of getting dental cavities. And the reason is that there's a lot of changes to your diet. If anyone has heard about cravings, that's one big way. There's also an increased acidity in the mouth if you are nauseous or having reflux, having severe vomiting. And then also there's increased risk of cavities because of dry mouth and just poor oral hygiene stemming from the nausea, vomiting, oh my goodness, I can't brush my teeth tonight kind of thing. The next thing that we see is erosion or wearing of the teeth. Also, this is related to that reflux and vomiting. If you do suffer from vomiting early on, reflux later on, I do recommend avoiding toothbrushing immediately after. Even though you have that terrible taste in your mouth, you just want to get it out, have a nice minty fresh taste. What happens is that your teeth are actually softer during that time, and so aggressively toothbrushing can wear away the surface faster, leading to erosion. So instead, I recommend rinsing with some water and even a little bit of baking soda to help neutralize the stomach acids in your mouth. Brushing too soon can worsen any erosion. What I personally did in these scenarios is I had some Act mouthwash in my bathroom, and so I would use a little bit of mouthwash if I felt like I needed to clean up after. The other thing that we do see commonly is something called a pyogenic granuloma, which is a very confusing name. It's essentially a round growth. It's usually connected to the gum by some tissue, and it can develop because of hormonal changes during pregnancy. So I'm just bringing this up because if you do see any, funny new growths in your mouth, don't be too alarmed. Definitely bring it up to your dentist. It's something they can easily take care of. Very good. Okay, let's move on. My last frequently asked question is, can I pass on the bacteria in my mouth to my newborn? We know new moms are very focused on their growing child, and we want to set up our children for success. So the answer is yes, you can actually pass on the bacteria in your mouth to your newborn child. And in fact, there's many studies that have shown that shortly after birth, the bacteria populations in mom's mouth and in baby's mouth actually resemble each other. So a lot of the bacteria in our mouth, it's not actually harmful, and some of it's even good bacteria, it's helpful bacteria, but it's all the more reason to make sure that there's no active oral disease going on in your mouth before baby is born. What do I mean by that? Make sure there's no cavities, no gum disease, none of the bad bacteria that you want to pass on to baby. So preparing for and having a baby comes with an overwhelming amount of information and advice, as I'm sure you've experienced. Everyone wants to tell you what's best for the baby and what's best for family, and ultimately it's really up to you and your physician to decide what's best. The topic of mom and baby's oral health, it's really often overlooked in the discussion, so I wanted to provide these tips today to make incorporating oral health feel easy and approachable. And a few key steps like sticking to a regular brushing routine, seeing a dentist regularly, and keeping a balanced diet can help ensure that both mom and baby have improved oral health. Until next time.